Mobile technology and social media are at the heart of a campaign used to address mental health issues, a topic that is often taboo in many cultures. Joining me to talk about Text Talk Act mental health awareness campaign is Carolyn Lukensmeyer. She's from the National Institute for Civil Discourse, and Wanda Parks. She's a student at Coppin State University. Welcome, ladies.
Thank you very much for having us.
So give me some background, because you were telling me earlier that this all started a couple of years ago, this campaign that we're talking about today. What was going on?
Well, after the terrible tragedy at Shady Hook Elementary School, President Obama actually called for a national discussion on mental health. He said these issues have to be brought out of the shadows into the light. We really have to get more comfortable as a country, as a family, as schools, talking about these issues. So our organization, the National Institute for Civil Discourse, was invited by the administration to initiate community conversations all over the country. And we really wanted to reach young people, because so often young people, the first symptoms of a mental health challenge show up when people are very young, 14 to 24, about 75% of the time. And yet, often because of family stigma or community stigma, the young person doesn't feel safe to come out and speak about it, which then means the symptoms get much, much worse before they ever get treated. So we initiated Text Talk Act. It operates directly how young people are using their devices.
And so go into that. So Text Talk, let's say I'm a 17-year-old and I've got a very active cell phone. What happens with that?
Well, what we set up was we would invite you to invite 2 or 3 of your friends to sit together and take your cell phone. You just type 89800 into the 2, and in the message you put start.
Okay.
And then you would receive on the text a video about what Text Talk Act is about, and it's done by other young people who've already participated. And then we'd send you some facts about mental health, and then we'd send you a few discussion questions. So your small group of people would talk about the discussion question. What do I need to know that I could help another young person if I saw them lonely or if I saw them acting strangely? And after you talk about it, you text your answers back, which goes to a website. When we did this on April 14th, which I know Wanda will talk more about, we had more than 6,000 young people across the United States all having these conversations.
Wow. Oh, so Wanda, talk about that, because there was this event that happened on April 14th, but you're a student over at Coppin State University.
Yes.
And you said that on campus, you know, some people may not know the signs and symptoms.
Well, that's a big part of it. We want to start the conversation about mental health, and Text Talk Act helps us. We had small groups throughout the campus. Some people were in dorms, some were in the quad, some were in classrooms, and they did the whole process, and it started the conversation, and we were able to get people talking. And it's especially important because that's not something that the African American community does, and Coppin, of course, is an HBCU, so that is very important, and just making sure that we talk about what mental health is and what to do when you see signs of a lack of mental health. So it's been very helpful, and we're going to do it again on May 7th, and we really want people to participate. And you don't have to be on campus, you don't have to be a student even. Getting that conversation going is important across the board.
Why do you think that is in the black communities, and in particular at HBCUs, which stands for historically black colleges and universities? But why do you think it is that maybe blacks, people in general, and blacks in particular, really kind of shy away from this?
I know for me, when I was a little girl, you got the message that what goes on in the house stays in the house. We don't talk about that, especially if you're in the church. There's a taboo there as well, and the church needs to step up and get people talking so that those issues can be addressed.
And Carolyn,
can I add something
Yeah,
there?
absolutely.
Just think for a minute in your own community. When a family announces that they have a son or a daughter that has a brain tumor, the whole community rallies around them.
Absolutely.
But if that same family announces that their son or daughter has just been diagnosed with bipolar, there's a kind of move away in most cases. So this isn't just inside the family. I don't understand it completely, particularly since literally 1 in 4 people in the United States at some point in their life have an experience of depression, serious depression, or something that is a mental health challenge. And yet somehow culturally, we haven't yet embraced it as just another aspect of being a healthy person. We treat it as somehow with a stigma.
May 7th, what's happening on May 7th?
Well, the reason that day is very important is that's Children's Mental Health Day nationally. So we are going to again have a big focus on Text Talk Act all across the country. And we hope many other colleges, Coppin was fantastic in terms of making it university-wide or college-wide. Many high schools did that. And part of our goal on May 7th is to extend it even to more and more and more cities.
And you know, when, let's say somebody texts in and they say, yeah, you know, I'm dealing with this, or I have a cousin who's dealing with this, or a classmate. What kind of resources do you send to them? How can they get help?
Well, because they're using text, we actually have their phone number. So if we saw a specific message that was a cry for help, then we actually have people who will respond to that cry for help.
Right, I see.
What we are very excited about, like when we did this on April 14th, as I mentioned, more than 6,000 students across the country and some non-students participated. We then did an evaluation survey, again through texting afterwards. 90% of them said they had learned something about mental health they didn't know before.
Wow.
And 65% of them said they felt confident they could help a peer if they saw them in trouble.
Wow.
That's really important.
Yeah, and they're the ones that a peer is going to go to, not necessarily always an adult.
Absolutely. At that age range, we all know that's true.
Got it. Stamping out the stigma. Keep up the good work. All right. So, Carolyn Lukensmeyer and Wanda Parks, thank you for joining me. The next Text Talk Act event is, as we mentioned, on May 7th. For details, go to creatingcommunitysolutions.org/Text Talk Act.